Good morning to the esteemed board of panelists. We are team 2 today from the College of Public Health, and our presentation is going to be about the sexually transmitted disease prevention in adolescents in Alachua County. And we are here to request as a team for the funding and grant for the same project. What does STD stand for? STDs basically stands for sexually transmitted diseases. Overall issue of STD is really a big crisis. Although many sexually transmitted diseases are preventable, the number of new cases in the United States is believed to be over 20 million annually, and the rates are rising according to the Healthy People 2030. According to the CDC, the Centers Disease for Control and Prevention, STDs are common, especially among the young people. There are over 26 million new cases in United States in the year 2018 from the ages between 15 to 24. Young people are at a greater risk of contacting STDs. Now, there are various reasons that young people are more prone for STD infections. One, as young women's bodies are biologically more prone to STDs. Two, some young people do not get the recommended STD test. Three, many young people are hesitant to talk openly and honestly with a nurse or a sexual health or a healthcare person about their sex life. Four, not having insurance or transportation can even make it more difficult for people to access the STD testing at a proper center. Also, another reason is some people have multiple sex partners, that is, more than one sex partner. Now, progress on the STDs. Over the years, there have been many changes that have been made, and there has been a improvement on the progression of STDs, but still the problem remains significantly prevalent. According to the Healthy People 2030, the new number of HIV infections, that is the HIV-1, there is no or little detectable change that has been observed. Second, when we talk about diseases like gonorrhea, the rate in young male adolescents have been seen getting even worse. Three, proportion of adolescent and young males with genital herpes, which is also another kind of STDs, has been at the baseline. And four, when we talk about pelvic inflammatory diseases, which are seen usually in young and adolescent females, it has also been seen at the baseline. These are the various reasons it is high time to take actions against these diseases.
Performance in Alachua County. Alachua County had a bacterial sexually transmitted disease incidence of 1,370.2 in 2020 compared to Florida's rate of 753.5. For this metric, Alachua County is in the 4th percentile. This indicates that compared to other counties in Florida, nearly 75% of the counties have an incidence per 100,000 bacterial sexually transmitted disease. According to the Florida Department of Health, Alachua County has consistently had a higher rate of STDs than the state of Florida. In 2021, the county had 1,748 reported cases of chlamydia, 532 cases of gonorrhea, and 29 cases of syphilis in the age groups of 10 to 24. The age group with the highest rate of chlamydia and gonorrhea cases was individual aged 20 to 24. The rate of HIV in 2021 was 383 per 100,000 population compared to Florida at 547.6 in the age group 20 to 24. Trends over time. For chlamydia, in 2006, the rate of chlamydia was 1,472.7 per 100,000 population. In 2014, the rate of chlamydia was 1,762.3 per 100,000 population. In 2021, the rate of chlamydia was 2,271.3 per 100,000 population. For gonorrhea, in 2009, the rate of gonorrhea was 350.3 per 100,000 population. In 2015, the rate of gonorrhea was 432 per 100,000 population. In 2021, the rate of gonorrhea was 691.3 per 100,000 population. For syphilis, in 2006, the rate of syphilis was 11.7 per 100,000 population. In 2013, the rate of syphilis was 22.4 per 100,000 population. In 2021, the rate of syphilis was 37.7 per 100,000 population. For HIV, in 2010, the rate of HIV was 24 per 100,000 population. In 2016, the rate of HIV was 35 per 100,000 population. In 2021, the rate of HIV was 4.8 per 100,000 population. So for HIV, we are seeing progress, but for other STDs, there are no progress. Reasons for progression barrier: decreasing the use of condoms among vulnerable groups, including gay men and sexually active high school students, poverty, lack of access to regular medical care, drug use, unstable house, discrimination, lapse in health insurance coverage due to unemployment, stigma, spreading infection by untested and untreated people, cutting budgets in STD programs resulting in clinic closures, reduced screenings, staff loss, and reduced follow-up and linkage to care services.
So, honorable board members, here are some of the policies and programs that are existing for prevention of STDs among adolescents. At national level, the CDC recommends that all sexually active adolescents be screened annually for chlamydia and gonorrhea. The Affordable Care Act requires most insurance plans to cover STD screening and treatment without copays or deductibles for adolescents. The Teen Pregnancy Prevention Program run by Office of Population Affairs provides funding for evidence-based interventions aimed at preventing teen pregnancy, which can also reduce the risk of STDs. The Office of Adolescent Health provides funding for programs that aim to improve adolescent health outcomes including STD prevention and education. The CDC's Division of Adolescents and School Health provides guidance and resources to schools and communities to promote healthy behaviors and prevent STDs among adolescents. The CDC recommends the use of condoms as an effective tool for preventing the transmission of STDs among sexually active adolescents. At state level, Florida law requires public schools to provide comprehensive sex education, which includes information on the prevention of sexually transmitted disease to all students with the prior approval of parents. The Florida Department of Health provides screening, diagnosis, and treatment for sexually transmitted disease at their county health departments. The Florida Health, under Integrated HIV Prevention and Care Plan, has partnered with community organizations and healthcare providers to increase access to pre-exposure prophylaxis medication. The Florida Department of Education has developed guidelines for HIV/AIDS prevention education in public schools under the Project Everybody, which includes information on the prevention of sexually transmitted diseases. At county level, Alachua County Public Schools provide comprehensive sex education, including information on the prevention of STDs to all students. The Alachua County Health Department provides screening, diagnosis, and treatment for sexually transmitted diseases at their clinics called as Clinic X. The Alachua County Health Department provides family planning services, including access to contraception to adolescents and other community members. The Alachua County Health Department conducts partner notification and contact tracing for individuals diagnosed with sexually transmitted diseases. The Alachua County Health Department partners with community organizations to provide health education and outreach programs aimed at preventing STDs.
Having explored the problem at hand, which is sexually transmitted infection amongst adolescents in Alachua County, we've made the following recommendations. The first one being the inclusion of comprehensive and age-appropriate reproductive health/sex education for students in the school curriculum. This will be adjusted to incorporate every type of students, including those with special needs or those with disabilities. The curriculum will be tailored to their understanding and appreciation across the grades. Then, abstinence, which remains the gold standard for prevention of STIs, will be elaborated on alongside safe sexual practices, including their advantages and their disadvantages. Then, regular STI testing and its benefits would be expounded upon. This is to arm them with the knowledge they need to make informed decisions about their sexual life. Then the next is the proliferation of reproductive health service centers across the county. This will help improve access for these adolescents to sexual transmitted infection screening and prompt treatment. This will involve setting up mobile clinics for these screenings and the treatment with less concession for the client's ability to pay for insurance. Then another important is the placement of contraceptives like condoms in strategic places like the school cafeteria, the parks, and shopping centers. This will also improve access for these adolescents to these contraceptives, preventing them from getting these sexual infections. Another is incentivization of the usage of the screening and mobile clinic, and this can be done by issuing gift cards to adolescent clients upon usage of such facilities. Then the last is the improvement of public campaign on vaccination against vaccine preventable sexually transmitted infections such as hepatitis B or HPV, and this can be done using flyers, or in this age of social media, it can be done using targeted ads via social media. And as most of these adolescents are using TikTok, Instagram, it can be focused on these to improve visibility and then educate them on the importance of vaccination against these vaccine preventable sexually transmitted infections.
Thank you, honorable members of the board. I'll be presenting funding. There are about 170,000 adolescents in Alachua County with over 60 public schools. These are individuals and areas of concentration during our proposed intervention. The budget is proposed to at the tune of 6,968,800 and expected to run for 1 year. Our justification is based off on funds that were approved to combat HIV epidemics in 2021 at the sum of 127.3 million, and also the disease intervention specialist workforce development funding for the Florida Department of Health from the CDC at the tune of 14,639,830. The breakdown of the proposed budget is expected to go as follows. There will be curriculum developments estimated to the tune of $4,300. Reproductive health services that involves renting of mobile clinic buses, salary for drivers, salary for mobile clinic nurses, salary for counseling services, procurement of testing kits and condoms, and development of gift cards for clients who present themselves for testing at this period is expected to be at a tone of 6,760,500. There will also be health campaigns on STIs in different schools and different areas of the town, expected to take the tone of $100,000. Office space that will accommodate individuals that will coordinate the events and the interventions is expected to take the tone of 104,000. That will enable us to erect a space and set up and also pay workers at this period. The return on investment is also expected that healthcare costs will be much reduced as compared to the treating of STI in 2018, where the US government spent around 16 billion in treating individuals with STI. Improved academic grades for the students is also expected, increased productivity and enhanced self-esteem among the students. Reduction in the prevalence of STI in Alachua County is also expected at the end of this intervention. In conclusion, honorable members, we humbly request that you consider and approve our budget based on these claims. The high prevalence of STI among adolescents and also the reduced healthcare costs that it brings to the government is better than you prevent than treating, as we can see the amount that was spent in 2018 in treating STI. Thank you, and we believe you shall consider us. Here also is our references at the end of the slide. Thank you.